All right, everybody, settle in. Today we're diving into something super important for all you amazing expecting parents out there. Pregnancy. It's a journey, isn't it? One minute you're marveling at your beautiful bump, the next you're convinced your left big toe is communicating with aliens. With all the changes, you might wonder if calling your OB/GYN is necessary. Spoiler alert, it's necessary. Your doctor is there to help. That's their job. They're like the pregnancy hotline, but with better qualifications. So, let's get into why you should call your healthcare provider. First up on our hit list of when to ring your doc is bleeding. Sometimes a little spotting can happen, especially early on. You read about implantation bleeding and you think, oh, that's just the baby signing the lease. But bleeding can also be a sign of something more serious, like a miscarriage or an ectopic pregnancy, or placenta previa where the placenta is in the wrong spot. These need a professional eye, not just a Google search. So if you see blood, call your doctor or midwife. They can figure out if it's a don't worry or a come on in situation. Next up, pain. Oh, the joys of new and exciting aches. Some discomfort is par for the course when you're creating a human. Your body is stretching, shifting, making room. But severe, constant, or sharp pain? Call the doctor. Bad back pain, especially on one side, could be a kidney infection. Persistent, severe, or rhythmic cramping could signal preterm labor. If a pain feels wrong or scary, it's worth a phone call. Your doctor can help decipher if it's normal or needs attention. All right, let's talk about swelling, or as I like to call it, the Michelin Man phase of pregnancy. A little bit of puffiness in the ankles and feet, especially at the end of the day or if you've been standing a lot. That's pretty common. But here's where it gets less haha, my rings don't fit, and more, this needs a professional opinion. We're talking about sudden or excessive swelling, especially in your hands, your face, or around your eyes. If you wake up one morning and you look like you've gone 10 rounds with a heavyweight boxer, or your fingers suddenly resemble sausages, that's a red flag. This kind of significant or sudden swelling, particularly if it's accompanied by other symptoms like a bad headache, vision changes, or pain in your upper abdomen, could be a sign of preeclampsia. And preeclampsia is serious stuff, folks. It's a condition that can affect both you and the baby, and it needs to be managed by your doctor. So if it's sudden, if it's severe, if it's in your hands and face, or if it just wrong to you, that's your cue. Pick up the phone. Okay, let's get personal. We're talking about pee. You're probably peeing more often than a toddler at a water park, thanks to that baby using your bladder as a comfy pillow. But what if things change? What if your urine starts looking cloudy or has a really strong, funky smell? Or what if it stings or burns when you pee? Or you feel like you have to go but only a tiny trickle comes out? These changes could be signs of a urinary tract infection or UTI. And while UTIs are common in general, they can be a bit more problematic during pregnancy. If left untreated, a UTI can sometimes travel up to your kidneys and cause a kidney infection. Even more concerning, an untreated UTI can sometimes increase your risk of preterm labor. So if you notice anything off with your pee patrol, if the color is weird, the smell is off, or it feels like you're peeing tiny fireballs, don't just chug a gallon of cranberry juice and hope for the best. Let your doctor know. All right, moving on to another delightful topic, vaginal discharge. You're probably noticing more discharge than usual, and most of the time that's perfectly normal. But what if it changes? What if it becomes really watery, like you're constantly leaking? Or what if there's a sudden gush of fluid? A sudden gush of fluid or a continuous trickle of watery discharge could mean that your water has broken. And if your water breaks before your full term, it's considered preterm premature rupture of membranes or PROM. This is a big deal because it can lead to preterm labor and increases the risk of infection for both you and the baby. Even if it's not a dramatic gush, but more of a constant dampness, it's worth getting checked out. Sometimes it can be tricky to tell the difference between a lot of discharge, a little bit of urine leakage, and amniotic fluid. But your doctor or midwife has ways to test the fluid and find out exactly what's going on. Don't try to guess. Let's talk about those magical little flutters, kicks, and jabs from your tiny roommate. Feeling your baby move for the first time is one of the most amazing experiences of pregnancy. Once you start feeling regular movements, usually in the second trimester, your doctor will tell you to pay attention to your baby's pattern. Most people start counting kicks around 28 weeks. Every baby is different. Some are chill, some are auditioning for Cirque du Soleil. But what if that pattern changes? A significant decrease in movements can be a sign something is wrong. Don't panic every time your baby has a quiet hour. If you're still concerned, call your doctor or midwife immediately. Pregnancy skin. Sometimes it glows, sometimes it's dry, and sometimes you get itchy. A little bit of itchiness, especially on your growing belly as the skin stretches, is pretty common. But we're not talking about the kind of itch that a good slathering of cocoa butter can fix. We're talking about intense, severe itching. And particularly if this severe itching is concentrated on the palms of your hands and the soles of your feet, that's a major red flag. This kind of specific, severe itching, especially on the hands and feet, can be a sign of a liver condition called intrahepatic cholestasis of pregnancy, or ICP. It happens when the normal flow of bile from your liver is affected by pregnancy hormones. This causes bile acids to build up in your body, which then deposit in the skin and cause that maddening itch. So if you're experiencing itching that's more than just a little annoying, especially if it's on your palms and soles and it's driving you bonkers, don't just suffer in silence. Call your doctor. Okay, let's talk about your peepers, your eyes. During pregnancy, you might notice some minor changes in your vision. Maybe your eyes feel a bit drier or your contact lenses aren't as comfortable. Some slight blurring can even happen due to hormonal changes and fluid retention. But if you experience more significant vision problems, that's a different story. We're talking about things like persistent blurred vision that doesn't clear up, seeing spots or flashing lights, double vision, or even a temporary loss of vision. These kinds of vision disturbances can be another warning sign of preeclampsia. Preeclampsia can affect blood flow to various organs, including your brain and eyes, leading to these visual symptoms. If these symptoms are new, persistent, or sudden, it's crucial to call your doctor. They'll want to check your blood pressure and look for other signs of preeclampsia. Headaches. Ugh, who needs them, right? Especially when you're pregnant. Unfortunately, headaches can be pretty common during pregnancy, especially in the first trimester due to hormonal changes, and sometimes in the third trimester too. Stress, fatigue, dehydration, caffeine withdrawal, all these lovely things can trigger a good old-fashioned noggin throbber. But we're not talking about your garden variety, I need a nap and a gallon of water headache. We're talking about a headache that is severe, persistent, or just different from any headache you've ever had before. Or one that comes with other fun symptoms like those vision changes we just talked about, or severe swelling. A severe, persistent headache can be a potential sign of preeclampsia. So if you're experiencing a headache that feels like it's in a league of its own, don't just pop a painkiller and try to power through. Especially if it's accompanied by other symptoms like blurred vision, spots before your eyes, sudden swelling in your hands and face, or pain in your upper abdomen. Don't try to tough it out thinking, it's just a headache. I don't want to bother anyone. Last but certainly not least on our Call Your Doctor tour, leg cramps. Oh, the dreaded Charlie horse in the middle of the night. You leap out of bed yelping, trying to flex your foot, wondering if your calf muscle is trying to secede from the rest of your leg. These are super common during pregnancy, especially in the second and third trimesters. So, the occasional leg cramp that goes away with stretching or a bit of massage? Annoying, yes. Usually a sign of impending doom? No. But what if the pain in your leg isn't just a fleeting cramp? What if it's a persistent pain, especially in one leg, and it's accompanied by other symptoms like swelling in that leg, redness, warmth to the touch, or tenderness when you press on it? This could be a sign of a deep vein thrombosis, or DVT, a blood clot in your leg. Now, pregnancy itself increases your risk of blood clots. And a DVT is serious because if a piece of that clot breaks off, it can travel to your lungs and cause a pulmonary embolism, which is life-threatening. If you have persistent pain, swelling, redness, and warmth in one leg, you need to call your doctor right away. Don't wait to see if it gets better. Phew, we made it through the list. 10 reasons, and honestly, there are probably more, but these are some big ones. It's a lot to think about, I know. Being pregnant is like being a superhero in training. You're growing a human, dealing with all sorts of new sensations, and trying to remember where you put your keys. It's amazing, and it can also be a little overwhelming, especially when you're wondering, is this normal, or should I be worried? The main takeaway from all of this, my wonderful NutriMama community, is to trust your instincts and never, ever hesitate to call your doctor or midwife if you're concerned. They are your partners in this incredible journey. They want you and your baby to be healthy and safe. No question is too silly, no concern is too small. It's always better to ask and get reassurance, or to catch something early if they're an issue. You are your own best advocate. Like and subscribe for more videos. We're here to support you with information, encouragement, and maybe a few laughs along the way. Now go enjoy that pregnancy glow, and keep your doctor's number handy. You've got this.